Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's August 2025 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled Plasma Levels of Fibroblast Growth Factor 21 and Adverse Kidney Outcomes. It is authored by Dr. Hee Bayun Ko from Catholic Kwangdong University International, St. Mary's Hospital in Yongsi, Republic of Korea, and colleagues from other university hospitals in Yongsi and Goyang, Republic of Korea. In its development and early progression, chronic kidney disease, CKD, can be symptomatically silent. Identifying biomarkers that forecast the initiation and progression of CKD would thus be clinically useful. In the present issue of Mayo Clinic Proceedings, Ko et al. Considered whether fibroblast growth factor 21, FGF21, may afford such utility, a thesis based on evidence that FGF21 levels may associate with adverse outcomes in other diseases relevant to CKD. Ko et al. Utilized the UK Biobank to categorize study subjects in either one of 2 cohorts. Cohort 1 consisted of greater than 32,000 individuals with an eGFR greater than or equal to 60 mL per minute and a urine albumin to creatinine ratio less than 30 milligrams per gram. Cohort 2 consisted of greater than 3,300 individuals with an eGFR less than 60 mL per minute or a urine creatinine to albumin ratio of greater than or equal to 30 milligrams per gram. In Cohort 1, 5.6% of participants developed CKD after a median follow-up of 13.7 years. Plasma FGF21 significantly associated with CKD. Additionally, when FGF21 was incorporated into a risk prediction model based on traditional factors for CKD, risk prediction significantly improved. In Cohort 2, higher plasma levels of FGF21 associated with incident kidney failure requiring replacement therapy. Interestingly, in Cohort 1, the association between FGF21 and CKD was stronger in participants with obesity and dyslipidemia, while in Cohort 2, the association was stronger with inflammatory markers. That FGF21 may forecast poor CKD outcomes raises a perplexing issue. FGF21 is a hormone with beneficial effects on glucose and lipid metabolism, and indeed FGF21 analogs are under consideration for the treatment of diabetes, obesity, and hypotriglyceridemia. Why should a salutary hormone be a harbinger of poor outcomes in CKD? Ko et al. Suggest that higher plasma FGF21 levels may represent either secondary changes due to resistance to FGF21 or compensatory response. Resistance to FGF21 signaling occurs in obesity, the latter strengthening the association between FGF21 and CKD in Cohort 1. Increments in plasma levels of FGF21 may occur so as to offset resistance to FGF21. Additionally, as CKD is associated with insulin resistance and dyslipidemia, adaptive increments in FGF21 may occur so as to mitigate these adverse effects of CKD. While this issue awaits resolution, the important and timely findings of Ko et al. Identify the association of FGF21 levels with poor outcomes, specifically in the initiation of CKD, the silent killer, and its progression to end-stage kidney disease. Our first highlight article this month is an original article entitled Artificial Intelligence Enhanced Electrocardiography for Prediction of Occult Atrial Fibrillation in Patients with Stroke who undergo prolonged cardiac monitoring. It is authored by Dr. Carmen Holmes from the Department of Neurology at Mayo Clinic in Rochester, Minnesota, and colleagues from the Departments of Neurology and Cardiology at Mayo Clinic in Rochester, Minnesota, and Jacksonville, Florida. Since its introduction, the AI-enhanced ECG, AI-ECG, has been shown to predict, among other conditions, left ventricular systolic dysfunction, cardiac age and heart failure, sex, long-term mortality after cardiac surgery, and atrial fibrillation-associated cognitive decline and cerebral infarcts. The present study of Holmes et al. Advances the field by evaluating whether AI-ECG may detect occult atrial fibrillation in patients after stroke. Clinical atrial fibrillation predisposes to stroke, and a major objective after a stroke in such settings is prevention of recurrence of stroke by anticoagulation. However, atrial fibrillation can be asymptomatic and paroxysmal, and such characteristics underlie the rationale for prolonged cardiac monitoring so as to uncover occult atrial fibrillation. Prolonged cardiac monitoring is costly, however, and certain findings disclosed by prolonged cardiac monitoring, such as a very low burden of atrial fibrillation, may not necessitate anticoagulation. Holmes et al. Analyzed patients with ischemic stroke evaluated at Mayo Clinic from January 1, 2018 to December 31, 2020. In 863 patients with relevant inclusion and exclusion criteria, the AI-ECG was used to assess the likelihood of atrial fibrillation detected by prolonged cardiac monitoring. The criteria of TOAST, trial of ORG 10172, in acute stroke treatment, and an embolic stroke of undetermined source, ESUS, were used to determine stroke etiology. The findings demonstrate that prolonged cardiac monitoring detected atrial fibrillation in 9.8% of patients. The AI-ECG had a negative predictive value of 94.2% and a specificity of 81.8% for excluding atrial fibrillation on prolonged cardiac monitoring, and a negative predictive value of 96.7% in evaluating patients with an atrial fibrillation burden of 6 minutes or longer, a threshold with a higher risk for stroke. Holmes et al. Conclude that the AI-ECG reliably identifies patients unlikely to have atrial fibrillation on prolonged cardiac monitoring, and in predicting which patients will have longer episodes of atrial fibrillation on prolonged cardiac monitoring. Their study is one of the largest to date that addresses this issue, and as Holmes et al. Persuasively point out, these findings may aid decision-making and patient selection in proceeding with prolonged cardiac monitoring in the post-stroke setting. Our second highlight this month is an original article entitled Cross-Sectional and Longitudinal Associations Between Family History of Type 2 Diabetes Mellitus, Hypertension, and Dyslipidemia, and their prevalence and incidence. Toranomon Hospital Health Management Center Study, Topics 24. It is authored by Dr. Izumi Ikeda from the Departments of Hematology, Endocrinology, and Metabolism at Niigata University Faculty of Medicine in Niigata, Japan, and colleagues from other hospitals in Tokyo, Japan. Aikida et al. Examined associations between family history and the occurrence of type 2 diabetes, hypertension, and dyslipidemia. This analysis was based on data from more than 41,000 participants who underwent annual health examination from January 1, 1997 to December 31, 2007 in the course of the Toranomon Hospital Health Management Center study. The latter study provided routine health screening of seemingly healthy Japanese government employees along with community members. The salient findings demonstrate that, in cross-sectional analyses, the prevalence of each disease significantly associated with a family history of the same disease, especially as the number of relatives with the respective disease increased, and that while the prevalence of type 2 diabetes and hypertension increased when the family history spanned 3 generations, such increased prevalence was striking for type 2 diabetes. Longitudinal analyses demonstrated that family history of the relevant disease associated with incident type 2 diabetes, dyslipidemia, and hypertension, and indeed, family history exerted a more powerful effect for each disease when compared with other relevant major risk factors. Notably, Aikida et al. Also demonstrated that increased body mass index strengthened the association of family history with the prevalence of each disease. In discussing their findings, Aikida et al. Underscored the following considerations. First, the large sample size and the longitudinal nature of their data enabled not only the assessment of disease prevalence, but also risk assessment. Second, such risk assessment as afforded by family history ascertained simply from the patient's history, and specifically for type 2 diabetes, may approach those ascertained by polygenic risk scores based on sophisticated GWAS analyses. Third, even when there was significant risk for these diseases as derived from the family history, such risks were substantially reduced at lower levels of BMI. These findings will underscore the importance of weight reduction in individuals predisposed to these diseases because of family history. This unique and timely study of Aikida et al. Provides new, therapeutically relevant insights that persuasively underline the importance of the time-honored teaching of taking a comprehensive family history in the course of the history and physical. Determining risk and predicting disease may lead to strategies that may reduce the likelihood that such diseases occur. Papers discussed in this editorial address aspects of these issues. These studies utilize tools that vary from the simple and straightforward, such as obtaining a family history, to the use of possible biomarkers, such as FGF21, to recent innovations in diagnostic tools, such as AI ECG. As the spectrum and sensitivity of omics, precision medicine, imaging, and other innovations in medicine evolve, they hold out the promise of affording new and unanticipated opportunities in disease mitigation or disease prevention. You can access these highlights and editor's choice articles free of charge during the entire month of August. We invite you to visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the contact link in the gray bar at the top of the homepage drop-down menu to follow us on YouTube, Facebook, and X. On our YouTube channel, you'll find full-length author interviews called Insights, and our MCP 60 seconds video article synopses. Another feature of interest on our homepage is a collection of articles that honor the past and look to the future in anticipation of our upcoming 2026 centennial celebration. In addition, our website also includes our Mayo Clinic Proceedings issue summary and Author Insights podcast recordings, which are available from our website on the homepage as well as through iTunes. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.